Bob Carter. I'm with SIM in Kenya. A couple of observations. I had the opportunity in December 2008 to attend the ICASA conference in Senegal. That's the International Conference on AIDS and STDs in Africa. In that whole week-long conference, there was one session that was given over to the topic of the role of traditional leaders and faith-based leaders in the global fight against HIV and AIDS. And so in one session, only half of it was for religious leaders and half of it for traditional leaders. It's interesting that they lumped traditional leaders and Christian leaders all together in the same. I mean, there is a difference, but they lumped them all together there, and that was only one session out of an entire week. The whole rest of the week, when there was reference made to the impact of religion on the fight against HIV and AIDS, it was almost always negative, talking about the barriers that were erected by religions in the fight against HIV and AIDS. The conventional wisdom in the secular world, with few exceptions, is that the religious community, irrespective of the religious community is part of the problem. And I think one of the reasons has already been mentioned in that we're not very good at really getting out there what we do. Perhaps one of the few exceptions to this is the African Network of Religious Leaders Personally Infected or Affected by HIV and AIDS, which goes by the acronym of ANARELA, which at the International Conference in Mexico City, they were so impressed with that they decided they wanted to make this international, so instead of ANARELA, they wanted an INARELA. And that was really the first well-publicized, that I'm aware of, well-publicized positive response to religious leaders. And I think the reason that it received such positive reviews is that these are religious leaders who themselves are living with it. So they have credibility. So I think what we have is a credibility problem. And as a religious community, we got off on the wrong foot 30 years ago. And we all know that it's really easy to lose a good reputation and very difficult to gain it back again. And so that's partly what's facing us. And in order to be able to overcome this, I think we need to get much better at publishing and getting the good work that we're doing out there. In many developing countries, it's the faith-based organizations, the churches, the mission, that are providing 50 to 60, in some cases 60% of health care in the rural areas. And the secular world generally is unaware of this. And so one of the things, the challenges that I think that we face as Christian healthcare workers is we are so busy just doing what we do, and we put a lot of volunteer hours into this, we simply don't have the time to document what we're doing. And if we don't document it, we can't put it out there. And so I love what Robin said. I think that's really hitting the nail on the head, Robin. Thank you for that, is that we have to find ways to collaborate with partners who are in a position to document what we're doing because we don't have the time to do it. We know we're doing good work, we just don't have the time to document it and to publish.
I must say, when I read this title for today, the thing that really jumped out was the changing world. And it's changing so fast right now while you're all sitting here doing retrospective that I'm going to challenge you to say, how are you going to deal with these dynamic changes? Are you going to be like the CIA and wake up and say, well, what happened in the Middle East? Nobody told us this was happening. Surprise, surprise. You've got, and one of the things that your organizations have is presence in those levels of population bases in countries where you can have that dialogue, and you can be way ahead of the game, which means you then incorporate a lot of these concepts into the strategies that are being made over your heads, and stop complaining about it. You're not there to really deal with the dragons. And that means you've got to be articulate, you've got to be observing, you've got to be asking questions, shut up, stop doing, and see where is this going, and what do they want, and what can they offer to do with you. This is the strength of the demographic dividend in all these countries in Africa, where 75% of the population is under age 25. They're making changes. They're going to be the ones. Who's dialoguing with them? Who's organizing them? Who's giving them administrative and corporate design strategies for advocacy, for training? This is where the change comes. And I'm in Seattle now, and I do battle with some of the organizations there who have strategies that are so out of step with what is going outside the Puget Sound area. So that's what I leave you with.
Okay. Well, and what I'll leave with you, Larry, is during the course of the next couple of days, you work with us in trying to understand what direction the world is going in, and what CCIH and our collective community should do about it. You kept saying you, and I want to challenge you to be part of the you.
Well, I am, but I'm not CCIH. I'm
you are
African communities.
You are CCIH. You are CCIH.
I think you've heard me before, Henry Mosley. I just want to give a little academic perspective to some of this, because two things. One is, one point we've made is that, big groups like the Global Health Council and many of these organizations are concerned with diseases. And of course they say, well, chronic disease is the future. Well, the thing is, one thing that most people don't know is the reason we're seeing more chronic diseases is not because we have dropped the death rate so low in childhood diseases, but because we've dropped the birth rate so low, and the population is aging. And so relative to the young people, we have more old people. So the population gets older, not because we've improved health, but because we've dropped fertility. A demographic lesson, I hope all of you think about it. It's counterintuitive, but it's reality.
That's not entirely true, though.
We've had some figures.
Let's celebrate our successes.
I think we can celebrate some, but so the rates have gone down somewhat. But in vast populations, in Africa, for example, infant child mortality is very high, and malaria is not under control. It's at unacceptable levels, and But the other point I want to make about the evidence-based thing is that, indeed, if you're looking at a biological intervention like a vaccine, or whether you can reduce the dosage of HIV drug and still get the same outcome, then you want evidence, because once you learn it in one population, it's relevant for all other populations, because biologically it was the same. Okay? But when it comes to program interventions, an intervention that gets people to accept a vaccine in one population, or to treat diarrhea effectively, or to get mothers to go to antenatal care, or for childbirth care, or use contraception in one population, no matter how you learn to do it, is not necessarily applicable to another setting. And one thing we need to, and in fact, there's been critique about evidence-based research, because for social interventions, often the results are not replicable for two reasons. One is if you go to a different setting, the context is different. But the second thing is, even in the same setting, there are a whole bunch of non-measurable changes in terms of values and practices when you have a project that is not being measured. And so then when you try to replicate the project by the government, that's been done by highly qualified team, you don't get the same results. And so there's lots of critique about, so-called evidence-based research. In other words, we need to create evidence, in effect, to learn, to go where there are no maps, which is what you're talking about. We are, if there's evidence, it means somebody's been there. But in the future, nobody's been there yet, and that's where we're going. That's what you're saying, that we need to. And the other thing about the evidence-based, the reason academics like that is because donors pay more money for it.
That's it.
Because what they're doing is they're buying indicators. And so we want to do this and this and this, and we'll put so much money in on this side, and you create the indicators on this side. Then the project is over, and you come back 2 or 3 or 4 years later, and everything is back to the way it was before. So this is a challenge that we have. And, the reality, the critique of the fact that billions of dollars spent in Africa with very little to show for it, and yet there have been huge numbers of evidence-based studies, but it hasn't produced a fundamental change. But the church has in many, many areas and in many places.
My name is Amy Metzger. I don't know who has read Brian Feichert's book, but I'm just a big fan of it these days. I'll try to make it brief, but it's called When Helping Hurts. He's with the Chalmers Institute. But I think I've been traveling for the past 12 years all over the world. I see more missionary type people. I know a lot of people, there's a whole host of different people in the room, but it seems like if you're a person outside of the Christian realm, speaking to whether we're taken seriously, often those people see the type of people that are hurting, that are going into these environments and not really doing it in a developmental way. In that developmental way, that's more of a Christian thing, I would say, because of the compassion that we have. People don't do it in a developmental way. Just very briefly, he made a great point that most people working in development are actually doing relief work when they should be doing development. They don't know the difference. I'm not saying people in this room, I think a lot of people in this room do know the difference, they're doing it, but there's so many, we all know how many missionaries and short-termers that are out there. I'm not criticizing any of you. I know, there's the whole gamut of type of work, but from my perspective, I see so many people out there doing work. They have good hearts, but they're not doing it in a developmental way. And his book, I haven't read his book. I was telling someone I didn't think I needed to read it, but he was at a conference I went to recently, and I just couldn't get enough of him. I believed in what he says about whether development helps or hurts, but I heard him like 3 sessions. I'm like, okay, I have to see someone else now. I have to, not spend all my time listening to Brian Feichert. But if you haven't read his book, I think if you've never had him here before, When Helping Hurts. I know different organizations. I was just at Salvation Army. They were passing it out. They gave it to us at Compassion. But if you've never had him speak here, he's funny. He's so engaging, and he had a room full of people who've never heard that message, and I think he was getting through to them. But I think that's what people think of when they think of Christian workers. It's the ones that are giving out candy, giving out free everything, and that's not. I don't think that's very developmental. So.
Thank you, current and past presidents. And I hope this reflection this evening is a good start for our several days together.